Doctors in central Ohio are battling a troubling measles outbreak affecting children. More than 80 kids have been infected, and at least 32 of them have required hospitalization. Here to react is Fox News medical contributor Dr. Marc Siegel. Doctor, good morning to you. Happy New Year. How concerned are you about this?
Happy New Year. Carly, I'm not that concerned about it nationwide because we're still in a position where 94% of kids are getting vaccinated. It is a warning about measles, though. Measles is an incredibly contagious virus, and everyone thinks it's very minor, but you just mentioned that 32 kids got hospitalized. It can cause pneumonia, and that's the biggest thing you worry about with measles. In this area of Ohio, the first 4 kids who got this were not vaccinated, and of the 82 you mentioned, none of them were fully vaccinated. Now, what do I mean by fully? That's getting both shots by the age of 5, and then it's 98% effective. This isn't what we've been talking about with the COVID vaccine or the flu vaccine. This one prevents spread. This one is dramatically effective at preventing spread, which is what everybody's talking about. This vaccine is hugely important, and we have stamped out measles in the United States as a natively occurring disease. This is the way to keep it that way, is with vaccination.
Dr. Siegel, there's also this story that is a big one in the world of sports. Dolphins quarterback Tua Tagovailoa, he's in concussion protocol for the second time this season. He got the concussion actually on Christmas Day during a game against the Packers, played the entire game, and then he went into concussion protocol the next day because that's when he started experiencing symptoms. A few questions on this topic, but the first one is, have you ever heard of delayed concussion symptoms like this before?
Absolutely. And I'll tell you, I saw the film footage of this. I know when he got hit. He got hit in the second quarter. He got really clocked, and I could tell he was going to get a concussion from that. Generally speaking, he must have had something. Maybe he was woozy. But some of these symptoms like headache, you can't concentrate, slurred speech, problems walking, balance, dizziness can be delayed a day or two. Do I think he had no symptoms at the time? That's harder to believe, but a lot of it is delayed. But look, you know what I'm most worried about with Tua? This isn't the first time. In September, he had back-to-back games when he got hit really badly. And we're worried about recurrent injuries like this to football players. He's 24 years old. There's chronic traumatic encephalopathy to worry about. One study out of Boston University showed a high amount of that in football players that have recurrent injuries like this, like concussions, traumatic brain injury. So I would be on the lookout. I think the NFL is probably right to have him sit out of the New England game today, by the way.
You know, Dr. Siegel,
I think they're right.
He's so young, he's so talented. I understand him being eager to play, but if I were anybody in his orbit, his wife, girlfriend, mom, I'd be really worried about CTE. What are the chances that could be in his future?
Well, I think there's a lot to be said for a great point, Carly. If he sits out now, maybe even sits out, the remainder of the season, maybe, really gets looked at very carefully over the summer, that he can make a full recovery. CTE, though, is a real issue for recurrent blows to the head. Now's the time for him to be sitting out and looking after his health first. He's not going to, I've interviewed Harry Carson, by the way, former New York Giant middle linebacker, Hall of Famer, who's been a major sportscaster for us, and he's been through this, and he teaches about this. Now is the time for Tua to sit out.
Yeah, well said. All right, Dr. Siegel, thank you so much for joining us. We appreciate it.